So think about who's going to be Johnny in your office on Monday morning and what each of you are going to do to create a positive special environment for your patients.
We honestly believe that case acceptance is a team approach, and getting patients to say yes is obviously our goal, but we think that the team often plays a much bigger role in that than the doctor themselves. And we want to help all of you get to the point where you can look at it, everyone from the dental assistant to the hygienist to the administrators and the doctor together as a team are helping that patient get to the place of yes, and not saying those dreaded things like, I'll think about it, or I'll do the fillings, but I'm going to wait on the crowns. There is a way to work together as a team through communication to have a higher rate of case acceptance, which I'm sure is something that all of you would be interested in. One of the ways that you can do that is to create a wow experience. And the wow, many times offices are great with wow when they're face-to-face with people. So when that new patient enters the building, they're usually pretty game on. We have a lot of flying offices that we go to that they're giving a good tour, they're greeting the patients appropriately when they come in. But it's the harder thing to find is practices that answer the phone well every single time and have a slam dunk initial phone call 9 out of 10 times. So we do a lot of secret shopper calls, and this is one of them we videotaped it.
Doctor's office. Yeah. Today? I don't know. Hold on a second, okay? Yeah, thanks.
I don't know if you can hear her right now on her cell phone.
You think so? Hello? Yeah, I'm at work. Yeah, I got somebody on hold. Yeah, can you hold on a second? Yeah, all right, hold on. I'll get right back to you. Hold on. Hello? No, sorry, I don't have anything today.
So that's what happens when you don't answer the phone. So we want to encourage all of you to improve the way you answer the phone. We're going to talk a little bit about that. We do think that a great tip is to have someone answer the phone during lunch. I know oftentimes teams are resistant to this. They would prefer to take their lunch together. However, going back to the schedule of our patients and how demanding life is right now for people, oftentimes that same lunch hour that we take and we leave and we put an answering machine on, that's the same lunch hour that potential new patients are taking. And they're trying to move forward with their lives and make phone calls like a phone call to a new dental practice during their lunch break. And myself, as a new patient, if I got an answering machine on the first call and I was on the internet, let's say, and I picked the #1 on Google Places and I got an answering machine, I would go right to #2. So there's a huge opportunity that a lot of us miss out on when we do not answer the phone. So this is another action plan item, and it's a culture item. You have to think about it and decide how you can make it work. But staggering lunch hours so someone can answer the phone during lunch is a great idea.
I never realized how often you say the word often.
Do I say often a lot?
Oftenly.
Oftenly? Is oftenly a word?
I don't know.
I don't know. It is now. Okay. Message on hold is another favorite of ours. I recommend it often. Telephone on hold is a great company. The guy who owns the company is Justin Ginsburg. If any of you are interested in finding out more about his service, check out his website. They use a soundstage. You pick a custom voice. You create your own scripts with their help. They're excellent. So that in the event that you do need to put a patient on hold, which we hope is infrequent, but we all know what happens, there will be things that they will understand and hear on that message that describe exactly what you can do for them. Instead of staticky music or, God forbid, those annoying beeps that some offices have when you put someone on hold.
Or the sounds of silence.
Or the sounds of silence. Silence is deadly on the phone, by the way. That's another situation that you need to resolve. So Justin Ginsburg, if you reach out to him, if any of you are interested in his service, and you tell him that you met us and that you're at one of our seminars, he will offer to give you the New York meeting special or whatever. He's a great guy and phenomenal service. So give him a call. So the initial phone call, we've spoken a lot about it. Do any of you here have a written system for the way you handle new patient phone calls? Show of hands. Couple?
I see one hand in the back.
Sit. Client office.
And our client.
Okay, excellent. So, are the new patient phone calls stressful for any of you when they come in? Do you worry about the questions that the new patients might ask?
What's the purpose of a new patient phone call?
Schedule an appointment.
Good.
Excellent.
Is it to give lengthy explanations of all the different types of whitening? Is it the time to go into an in-depth analysis of what their insurance benefits would be for each and every procedure they may need? Absolutely not.
So I want to encourage all of you that answer the telephone, even if it's not your usual job to answer the telephone, even if you answer it occasionally, as of right now, you have become the director of first impressions. Because every time that phone rings and it's a new patient on the other line, you have become the director of first impressions. So you only have a couple of seconds to make a great first impression. This means that not only the administrative people who most commonly answer the telephone, but anyone that ever considers touching the telephone in the office when it rings needs to be trained on these skills. One of the #1 things that you want to do in that phone call is create value and cheerlead and say things like, you have certainly called the right place. You are going to love Dr. Wonderful. She is terrific, and I should know because I'm a patient too. Those are the types of things that you want to say to your people when you're talking to them on the phone. So there are 5 skills. The first one is the greeting. And like the video that we saw, I saw a couple of people cringe when we watched Sherry answer the phone and she said, "Doctor's office." We want to try not to do that. That's terrible. We definitely want to let the patient know, the potential patient, we want to let them know that they have in fact called the right place. So let's start off by saying something like, "Thank you for calling Dr. Pieri's office. This is Kelly. How may I help you?" There are a couple of things that go on there. Number 1, the voice is friendly, it's upbeat. When I answer the phone, I try to smile every time, no matter how silly I may look to the people around me, because I know that I sound happier and more pleasant when I'm smiling. That's
Those of
fact.
you who answer the phone, I want you to put on your action list that you're going to get a small mirror. And you're going to put it either next to or behind the phone that you answer. And when the phone rings, you're going to look at the mirror, you're going to give the mirror a big smile, smile at yourself, and then pick up the phone. Do you know that your voice is different when you smile? You sound much more cheery, you sound much more up-tempo, and you sound like somebody that people want to be with.
The idea, because remember, you're the director of first impressions. The idea is to welcome them. So your voice needs to be incredibly welcoming right out of the gate. So the other important thing that I do when I say my name is I let them know that now they know someone. Everyone wants to feel like they have someone. Everybody wants their own P.C. Richards guy. Everybody wants to know a guy at a car dealer. Everybody wants to be in the know. So by me telling them who I am, that lets them know that now they have a connection. I've identified myself. So we want to, very often when patients call, they ask questions. And they're not necessarily asking those questions because those questions are important to them. Most of the time they're asking those questions simply because they do not know what else to say. We sometimes forget as dental professionals that there's a huge number of people that have dental phobias. That it's not always fun for people. Very often if they have left another practice to come and see us, there may have been some negative thing that happened to them that they're not particularly happy about. They may be afraid or concerned that it's going to happen again. So they're not professionals at knowing how to find a new dentist. Sometimes they say the first thing that comes to their mind. And anybody want to tell me what the first question usually is?
You take my insurance.
You guys are so good. Okay. I have found, working as an administrator, that it's a very, very interesting exercise that when people ask that question, there are a huge, if you're working in an office that does in fact take some insurance, There are a huge number of patients that ask that question, and then when you say to them, how did you hear about us, they say, I found you on the Cigna website. Very interesting. They just didn't know what else to say. So they're asking that as sort of their opening line. So you want to briefly answer their questions. If they say, do you take my insurance, you want to respond with something like, we are a very insurance-friendly practice. I'd be happy to do a complimentary benefits check for you when you come in. Or if they say specifically, do you take Cigna? You may want to say something like, we have so many patients that have Cigna. That's wonderful. We love patients with Cigna. So now you're going to go into a transition. If you have not already asked them their name, you want to do that so that you can continue to use their name back to them throughout the conversation. There is no sweeter sound that a person can hear than their own name. So as quickly as you can in that dialogue, get their name. Now you're transitioning, you need to take control of the conversation again. And when we do our secret shopper calls, we find that most offices do not have a good system for regaining control. Once the patient asks those questions that are difficult to answer at times, the person from the practice loses control and goes into a total dialogue trying to educate the patient. Things that you're never going to resolve in one phone call. You're not going to solve all the problems of the world in an initial phone call. So you need to keep it short and sweet, and remembering what Dr. Katz said. The main purpose of that call is to get the body through the door, get them in so we can wow them, show them how much we care, and show them why we're special. Once you make that transition and you regain control again, if you've not already asked, you definitely want to say, how did you hear about us? Thank them for whatever the source is. If it's a personal referral from a patient, that's a really big deal. You want to roll out the red carpet and say how much you love that patient, even if you don't. Say wonderful things about them. And then we're going to go into the dual alternative close, which is where you now say to the patient, knowing your block schedule, knowing what your week looks like, and where your new patient blocks are, you're going to say to them, do you prefer Mondays or Tuesdays? Once they picked one of those, automatically you know you have morning and afternoon. You're going to say, do you prefer morning or afternoon? This whole time you're leading them into a spot that they think they've selected for themselves, but you're actually putting them in the spot that we have designated for new patients. And when you give people two choices, they really have to pick one, especially if it's morning and afternoon. There's really not a lot of in between. So this gets us away from that uncomfortable situation where you say, well, what's your schedule like? And they say, I can only do Saturday morning and practice is closed on Saturdays. So now you've gotten to a no. You want to be a yes person on the phone. Everything that you do in this phone call is to get to that place of yes, and the yes is when the patient makes the appointment and comes in.
And does anyone here, when they're dealing with the schedule, say, well, we have this time, or, you know, we'd like to have you take this time, or I've got 10 o'clock available? Well, who is it about when you're telling them that you've got this time? It's about you. That's why the dual alternative close makes it seem like it's about them, and that's more important. So do you prefer, would you prefer morning or afternoon? Do you prefer Monday or Tuesday? It's letting them think that they are in control even though you're the one controlling the time.
And then the last thing that you want to do is data capture. And regardless of what type of practice you have, whether you have a high level of insurance participation or none at all, data capture should be to a bare minimum. There are only a few things that you need to know on that first phone call, and that is definitely their first and last name, at least one phone number, preferably two, an email if you're planning on communicating with them via email for their new patient forms, and who referred them. That's it. You don't need anything else. If you're collecting anything else, oh, let me just say, if you're not computer savvy and you're not doing emailed forms and you need to physically mail them, snail mail, then you want to get a mailing address. That's it. Social security number, insurance card, date of birth, all that stuff is nonsense. You don't need it. And if anybody wants to know why, we'll talk more about that later, because I'm going to try to stay on time.